New imaging technologies in retina have allowed us to look at the retinal microstructure in a way that we couldn't do before without having to do histopathologic evaluations. Adaptive optics OCT is a special type of OCT technology. And what that does is it allows us to improve greatly the lateral resolution of our imaging. And what that allows us to do practically is it allows us to take a look at the very specific cellular layers of the retina, and in fact, in some cases, individual cells of the retina. Those individual cells can give us a lot of information as to the function of the retina, and that helps us identify diagnostically what's going on in the patient, but also help with targeting our treatment for patients and following them over time to assess the value of the treatment that we're employing in them. The diseases that can be imaged with the new technologies include things that are common and uncommon. Things like age-related macular degeneration, both wet and dry, diabetic retinopathy, and then some more uncommon diseases like autoimmune-associated retinopathy, central serous retinopathy, and other types of retinal diseases. In addition, we are now able to use some of this technology for surgical retinal problems. And those surgical issues include things like integrating optical coherence tomography imaging in the microscope and allowing us to identify intraoperatively if we're achieving our surgical goals. And in addition, preoperatively evaluating patients with this imaging technology to identify where specific surgical targets can be. These new imaging technologies, optical coherence tomography imaging, and then advances within those imaging technologies themselves with swept source optical coherence tomography imaging, and specifically adaptive optics optical coherence tomography imaging, they have and they will revolutionize how we go about treating, diagnosing, and evaluating patients.